Hello. Good evening.
Good evening, Prof.
Good evening, Prof.
Yeah.
Good evening, sir.
Good evening. Let me welcome you to.
Good evening, Prof.
Yeah. Good evening. So let me welcome you to today's lecture. And let me welcome you to today's lecture. Yesterday we started with the history of public health, and then we said I think we're able to distinguish medical services from public health services, and then we said that the history of public health is actually the history of epidemics, and then we identified the three main causes or the three main attributions. Epidemics in course of history, the rot of the supernatural, miasma, that is bad air, and then foreign imports. And then we started tracing the history from Regosa, where the first quarantine was established in 1377, and then we went to the Board of Health, the Board of Health that were established by the northern Italian cities, and from there we met John Grant, who actually interpreted the weekly bill of mortality to actually used it to calculate life table. And then we met John Snow, who investigated the frequent outbreaks of cholera, and then was able to pinpoint the Broad Street pump as responsible, and that Broad Street pump was actually supplying sewage contaminated water. Okay, then after that we met Edwin Chadwick. Sorry. Okay, so we met Edwin Chadwick, who, working as the secretary of the Board of Health, was able to make that crucial link between deaths, the dirty environment, and the outbreaks, and this got the support of the middle and upper class ladies who supported it and mobilized for environmental sanitation. And not only that, facilitated the enactment of the Public Health Act in 1848. And this enactment led to the establishment of local board of health in all municipalities, in all councils, and they were charged with providing services that are now currently called municipal services: waste disposal, water supply, food safety, and the rest. The Public Health Act also recommended the appointment of medical officer of health and medical officer of health to ensure environmental sanitation in all the council areas, especially in slums. And because medical officers of health are still just single individuals, they usually recruit and train sanitary inspectors who went door to door looking for dirty environment and then compelling people to clean up. Then in that era, public health was basically environmental sanitation, and then came the germ theory. germ theory. With the acceptance of the germ theory, miasma, people now got to know that what was responsible for those epidemics were actually not bad air, not miasma, but microorganisms. So the public health practice moved from that of amateur, a profession of amateurs, to a profession, to a real profession, requiring significant skills in bacteriology. Because what public health officials were doing were to take environmental samples, and then take them to the public health laboratories that were established in that period, and then to determine whether the condition is able to trigger off epidemics. In fact, they were able to establish regulatory standards. For example, they found out that when a water contains less than 10 E. coli per deciliter of water, that water is clean enough and may not cause diarrhea disease. And they did that and that was how they practiced public health. And then shortly after, vaccines were developed. So vaccines gave them a strong weapon against the communicable diseases. So, and they quickly used the vaccination and even implemented compulsory vaccinations. And in Nigeria, we had reports of roadblocks being mounted, and law enforcement agents, together with public health officials, will now check all the papers of the passengers, and they only let go passengers who showed evidence of being vaccinated, and those not vaccinated were immediately vaccinated before they were allowed to continue with their with their journey. So these intensive environmental sanitation and vaccination led to significant decrease in the outbreak of these epidemic diseases, such that people thought that all diseases were caused by these microorganisms, until people like Alice Hamilton, Percival Pott, John Lane were able to demonstrate otherwise. Okay, and when they were carrying out these public health activities, they noticed that the effects, the outcomes were not uniform. That those in upper socioeconomic class, they achieved better results compared to those in the lower socioeconomic class. So that was how social condition became recognized as a significant cause of illness, and that led to the birth of social medicine. Okay, so today we'll be looking at the history of international health agencies. I know we live in a world. We share the same earth with people of different countries, and in course of history, epidemics, and because countries now, people now move from countries to countries for trade, for leisure, for better life, etc. It is feared that epidemic diseases can easily move from one country to the other. So international health is a significant part of public health. And the aim of international health is to stop the international spread of diseases, infectious diseases, epidemic diseases, without compromising trade. So it is a difficult thing to do, because if you stop international movement and international trade, as happened in Regosa, it means that yes, it will lead to economic rain. It will lead to decrease in economic activities or prosperity even worldwide. And of course, you will not want to allow epidemic diseases to spread from one country to the other. And the ways of doing this were discussed before the United Nations, before the League of Nations that preceded the United Nations. They were discussed in international sanitary conferences. They were discussed in international sanitary conferences. These international sanitary conferences were hosted mostly in Paris, of course, by the world powers then. Okay, and they had to find a way. To promote international trade, even without while stopping the spread of epidemic diseases. So they held several of them in Paris, and then in Vienna, and then the First World War broke out. And when it ended in 1919, the League of Nations was created. And League of Nations, where the purpose of this League of Nations was to foster international peace. And under the League of Nations, they also had the health office of the League of Nations. And the health office of the League of Nations, again, was established to ensure international trade while preventing international spread of diseases. And they also looked at ways of doing that. And one of the ways they actually found out, or they instituted, was, of course, that deliberations were all held in the open. One difference between the United Nations system, or even the earlier League of Nations, is the fact that discussions are held in the open. So unlike bilateral organizations or bilateral diplomacies that are usually held in the secret, for League of Nations and even the United Nations, discussions were held in the open. And then the part of the things they tried to do to prevent the international spread of disease was to institute vaccination. That before you can move from one country to the other, you have to be vaccinated against the most common epidemic diseases, especially those ones that have vaccines. You have to be vaccinated. Unfortunately, the health office of the League of Nations didn't achieve much. It was weak. It was poorly funded, and was not well coordinated. Mostly due to political interest. Those rich nations or the industrial nations, they want easy access to other countries for trade, while the other countries want to protect themselves against epidemic diseases. In fact, even during this in recent times, Ebola, some countries have even are contemplating banning people from the Congo DR, or even Uganda, from coming to their countries. From coming to their countries. This is one of those things that the League of Nations and then the now currently WHO try to prevent. But Whereas the League of Nations, the health office of the League of Nations was poorly coordinated. International NGOs were not. Private foundations were not. Were better coordinated. They are better coordinated. And the foundation with probably one of the greatest influence in public health, especially the early public health, was the one established by John D. Rockefeller. Rockefeller was an oil tycoon. At the time, he was the richest man on earth. He was the richest man on earth. He was the Rockefeller Foundation was the largest funder of global health in the first half of the 20th century. So he provided, this Rockefeller Foundation provided most of the funding required to operate the Rockefeller Foundation funded the health office of the League of Nations, and then was funded research projects, even educational efforts in more than 90 countries. John Rockefeller, although he was considered a monopolist because he monopolized the oil trade, but he nevertheless was the highest funder of public health programs in the first half of the 20th century. Rockefeller was also interested in the treatment of tropical diseases. So we have to commend him for that. Because a lot of big men, billionaires, are not interested in those tropical diseases. Not interested in tropical diseases, and even the drug companies are not interested in tropical diseases because tropical countries are poor. They can't. When drug companies invest money in discovering drugs that treat their problems, they usually do not make profits, so they are not interested. And that's why these tropical diseases are currently being called neglected tropical diseases, NTDs. I'm sure that some of you are aware of that. Okay, but nevertheless, John D. Rockefeller and the Rockefeller Foundation, they were interested. They were interested in funding tropical diseases. In fact, they funded the establishment of the London School of Hygiene and Tropical Medicine, John Hopkins School of Public Health, and the Harvard School of Public Health. They were established by Rockefeller Foundation to help in training and research in the research that's for the control of these tropical diseases. In fact, he was the one that funded the development of not only the causative agents of tropical diseases like hookworm, malaria, yellow fever, but also paid for the development of the yellow fever vaccine. So we have to give it to Rockefeller. Rockefeller became the richest man on earth through the oil business, the oil business. And this guy, Bill Gates, became the richest man on earth through computers. Yes, through computers. And he made his money, and he actually tried to replicate what Rockefeller did, because Bill Gates is now one of the highest funder of public health activities, especially, and he is particularly interested in polio eradication and provision of vaccines. In fact, he was instrumental to the development of the COVID-19 vaccines. He was instrumental to the development of COVID-19 vaccines. And not only that, he also worked to have these vaccines, these life-saving vaccines, given to developing countries through the Gavi initiative. If not for him, those developed countries were ready to bought up the vaccines, and making it very difficult for those in developed countries to have access to these life-saving vaccines. So Bill Gates, and under the Bill Gates Foundation, he funded the foundation originally funded the foundation with his ex-wife Melinda, and they have been very, very wonderful. Unfortunately, when you look at the social media, you just know he has been accused of all sorts of things. He has been accused of all sorts of things, and if you see and hear those conspiracy theories about Bill Gates, you want to ask, for what reason? For what reason? For what reason? He made his money. He made his money through Microsoft. He made his money through Microsoft, and at a time became the richest person. And then he decided that he's going to give out most of his wealth before dying. Before his death, he will give out most of his wealth. So does he deserve the vilification? Does he deserve it? And some of these caustic remarks are made by religious leaders, respected religious leaders, saying all sorts of things. And that was how they were talking about USAID and USAID and all those things. And then Donald Trump came and stopped everything. And people are dying. HIV programs, a lot of NGOs have folded up. So let those people that were paddling those conspiracy theories, they should come down. They should go and fund. They should provide the funds. And people, they can't step in. As the United States pulled back, those people concocting conspiracy theories, they have not showed up. And people are dying. People that used to work in NGOs, and some I'm sure that even some in this class have lost their jobs. So those people that are busy saying all sorts of things, let them come. They should have come. They should have stepped in to help now, since they have the purest heart, and the people helping out have ulterior motives. They should have stepped in. So, international organizations, international health agencies, starting with the League of Nations, of course, their main objective is to prevent international spread of disease without compromising trade. Okay, it was difficult, but they tried. They tried their best. And then the private foundations, international foundations, starting with Rockefeller in the first half of the century, and now Bill Gates in the latter part, currently. So then let's go back to the United Nations after the Second World War. When they fought the Second World War, they used to say that it is the war to end all wars. They considered Second World War as the war to end all wars. And when the war ended, they were all exhausted. And then they formed the United Nations and adopted the motto from Isaiah to Isaiah chapter 2, verse 4, which reads, "They shall beat their sword into plowshares and their spears into sporing hooks. Nation shall not lift up sword against nations, neither shall they learn war anymore." So after the war, everybody were all exhausted and they wanted a world without peace. And they formed the United Nations as an international organization to guarantee, to ensure that there is no peace. That is peace. That is peace. And then they have these Security Council members. And these Security Council members, the five permanent members, United States, China, Russia, Britain, France, they were all there, and they were to guarantee world peace. They were to guarantee world peace. Okay? Then they were to guarantee them world peace. So part of the whole thing, from the United Nations came other agencies with specialized roles. One of them is the WHO, the World Health Organization. Which was established in 1945, to take care of the health problems of the world, basically to take up the responsibilities of the health office of the League of Nations, to facilitate international trade, to stop international spread of disease, to reduce international spread of disease without compromising trade. Okay, but when WHO came on board, it's defined in its constitution, which is, of course, a constitution is the highest, is the guiding document. Is a document that guides the operation of an organization. So in that document, the WHO defined health as not just physical well-being, as we used to know, but social and mental well-being. Okay? So the WHO gave one of the broadest definition of health. A definition that a lot of us still struggle. A lot of us still struggle to imbibe, because we are still used to physical well-being as a measure of health. We are still used to physical well-being as a measure of health. And I used to say, if physical well-being is a measure of health, then we can say that a madman who can trek long distances is healthy. But we know he's not. We know that mad person is not. That mad person is not. The other day, as I was going to work, on a very sunny day, I saw one, probably destitute, lying on the median of the road. And I was just thinking, how is he able to survive that? So physically, which means that that's destitute, is physically strong, but we know that he is not. We cannot say that person is healthy. So when WHO defined health as a state of physical, social, and mental well-being, yes, and it defined it because of the circumstances of the period. Of course, physical well-being, people we know. But what of mental well-being? What of social well-being? Social well-being has to do with relationship with people. And after the World War, there was a lot of social problems. Wars usually kill men. So you have a lot of women, more women but very few men, very few male suitors. And he reminds us to what was predicted in the Bible somewhere. I think he actually followed a war, Isaiah 4:1, that talked about 7 women struggling for a man. Okay, so it actually happened during after the Second World War, and then spatial infidelity. Men went to war while their wives remained, and their wives did all. Some remarried, some were probably went into adultery, probably to survive, and some were even forced into prostitution. So the Second World War created a lot of social problems. So that is one of the reasons why WHO included that social well-being as one of the components of health. And then he also included mental well-being. Mental well-being because of the trauma. Mental well-being has to do with the ability of the person to survive the stress of life. And the war took a lot of stress. People that witnessed traumatic events, a lot of them came down with post-traumatic stress disorder. So a lot of people came down with post-traumatic stress disorder. So it forms part of the reason why the WHO had to include mental well-being. Mental well-being. Okay, so we now know the background to that WHO definition of health. Okay, so the WHO did its best, tried, but shortly after its establishment, the Cold War started. Russia and the West, they started having their problems. Each trying to subvert each other. But nevertheless, the WHO was able to record a lot of remarkable achievements. For example, it pioneered the training of health workers, especially in the developing countries, in the colonies that became independent. And of course, when Nigeria became independent, it assisted in training Nigerian health professionals. And so it did in other colonies like, of course, Ghana and the rest. So, which means that the WHO helped in the training of health manpower, especially public health personnel, and it still does it. Okay, but one of the most remarkable achievements of the WHO was the eradication of smallpox. Eradication of smallpox, and then it is very close to eradicating polio. So these are remarkable achievements of WHO in spite of the Cold War. WHO also convened successfully the Amata Conference of 1978, which it did with UNICEF, that led to the establishment of primary health care. And primary health care has been a success because it has made healthcare available to where people live and to where people work. So WHO. Then there are other international organizations, United Nations organizations like UNDP. UNDP has its headquarters in New York, and his main responsibility is to improve the life of people in developing countries. to improve the life of people in developing countries by training, improving them. So the main focus of UNDP includes poverty reduction, HIV/AIDS, democratic governance, energy and environment, social development, and crisis prevention and recovery. You'll be wondering, why are they interested in HIV/AIDS? Because HIV affects mostly the productive sector sector of the population, the working class, those that work. So those that work. So if they cannot work, if a parent, or if the parents can't work, it means that their children can't feed. Their children will have problems. And even other dependents like aged parents will also have problems. So that is the reason why UNDP, whose responsibility is economic empowerment, poverty reduction, is also interested in those diseases that affect the working class, the working population, such as HIV. For the United Nations Children's Fund, it was an emergency fund created by the United Nations in 1946 to take care of the children, take care of the children devastated in countries devastated by the war. So, but in 1953, it became effectively United Nations Children's Fund, but however decided to retain that emergency, to retain the emergency, international emergency, to retain that emergency in its acronym. But right now it is effectively United Nations Children's Fund, and UNICEF is mostly interested in the welfare of children and their mothers, welfare of children and their mothers. And UNICEF has done very well in child. It's launched together with the WHO what they call the Child Survival Strategies, and it is heavily involved in immunization and the treatment of diarrhea diseases. Diarrhea diseases are responsible for a lot of child mortality, especially in our environment, where our environment that is basically unsanitary. Then the United Nations Population Fund was established in 1969, and it is mostly responsible. Its objective is to ensure that every pregnancy is monitored, every childbirth is safe, and every young person potential is fulfilled. So UNFPA is basically involved in encouraging support family planning and all those and things that help women meet their potential. Then the Food and Agricultural Organization, they are involved in agriculture, improved agriculture, basically helping people, especially in developing countries, to raise their food security. Food security is the ability of a family to provide food that meets the nutritional needs of members of the household all year round. So it's the responsibility of the Food and Agricultural Organization. And this United Nations agency has done well. Remember that even in the 18th century, that Anglican clergyman, Thomas Matthews, actually predicted that the world will soon lose its ability to produce food, that the food will soon run out, so that people, run out. But with good agricultural practices, we now have the human population has exploded, yet we can still feed ourselves. In fact, if we remove or if we ensure that harvests are not lost, post-harvest losses, we are likely we will have enough food. And even at that, it is believed that there are resources, food. We have enough food to feed everybody if there are no corruption, or if government will let organizations actually get this food directly to people. So, and FAO is a UN organization which is working very, very seriously to achieve that. The World Food Program, they provide food. They help provide food to people who cannot produce and obtain food for themselves. So they provide UN World Food Program provide food in emergency situations. Provide food in emergency situations. The International Labour Organization, they are interested in in the health of the working population, the health of the working population. They help in establishing workplace standards, and then help in enactment of the relevant labor laws, like labor laws, employee compensation, and so forth. Okay, so that is that. Then the United Nations Environment Program, they are tasked with the responsibility of assisting developing countries in implementing environmentally sound policies and practices. Okay, and for those of us in the Niger Delta will remember the Ogoni-UNEP report. It was the United Nations Environment Program that conducted this study, a study that the oil companies try to stop because they didn't want their unhealthy practices or poor environmental practices to be made known. Okay, so United Nations Environment Program is charged with such responsibilities. Let's just quickly talk about aid, international aid, before we stop briefly for questions. And yes, for questions, international aid. Okay, countries help each other. We have talked about multilateral organizations, the United Nations and its agencies like WHO, UNICEF, and co are multilateral, so multiple countries working together. But we also have bilateral aid, one country helping the other. As much as possible, developed countries help each other. Developed countries help developing countries. And then some countries like Nigeria that also feel that they are more privileged than others and therefore are helping others. Okay, so but we have to say that countries help the other country. It is not just philanthropy. It's not just philanthropy, but part of the reason is what we call the global public health good. The global public health good. Part of the reason is the global public health good. A public health good is defined as things used by an individual that benefits not only the individual, but also other members of the community, country, and the world. Okay? And there are examples. A good example is vaccination, immunization. If you get yourself immunized, you protect yourself, but you are protecting your neighbors and others, because you will not be able to transmit that infection to others because of that vaccination. Okay, so developed countries are also interested. Because you are not going to come to their country and infect their citizens. Another reason is that if they let people in developing countries and not help them, these microorganisms will begin to spread, will begin to develop resistance, will begin to mutate and become forms that may be difficult to control in developed countries. And that's happened during the COVID-19 pandemic. In South Africa, the Omicron strain developed. The Omicron strain developed and became difficult, became very virulent, became resistant to even the common vaccines. So it's one of the reasons. So they want to help us so that not only because we will not be able to come to their country to
Prof, I can't hear you any longer. I don't know if it is same for other people. I can't hear you anymore.
I think it's network issues. Let's be patient.
Maybe it's network.
Yes, we can't hear you.
Please let's just hold on. I think to come back. We'll just
Prof, we're having network issue. Can't hear you.
Same here. We can't hear anything. Same here. We can't hear anything.
Network logged him out. Let's be patient.
not hearing anybody.
I'm awake now. It will come. I'm sure it's network.
Okay.
Good evening, everyone. I hope somebody has reached out to Prof to know what the issue is.
Hello, good evening, everybody. I can't hear anything from the class.
Pay attention.
Hello.
done. I'm sure
Is
Prof
there any,
network is little.
They've
can
already
you
said
hear
it a
the
number of
lecturer?
times now. There is network issue. Have patience.
Okay,
Abba.
okay,
Why you guys
okay.
just keep quiet? You should keep quiet now. What is, you can't you hear that there's network issue? Sophia,
Mute your mic. Mute your mics.
What do you mean by to fear? Come on now. People ask question, you answer. If you can't answer, you keep quiet. Don't ask people to fear. That's a very wrong statement to
some
make.
people are so bitter and so
At
disrespectful.
least
Like,
let
who
there
are
be
you
somebody
here?
that
Why are
address
you
the
saying
prof.
that they
So
should keep quiet?
you'll be aware that we
Are
are not
you
hearing him
okay?
anymore.
Do you think this is your house? You're saying they should keep quiet. Who should keep quiet?
Oh, we lost him completely?
If you
Exactly.
check
If
the
if
participants,
at
you would
yes,
notice
if you
that
are
he's not
following,
here.
you notice that he's no longer in the
Observe.
meeting.
Check the
Yeah, let's
participants. You will
wait.
see that he's not here anymore.
He
Exactly,
will come
exactly.
back. Let's be patient. He will be
Probably
back.
network has logged him.
He's back.
Sorry, I had an outage and then apologies, but
Perfect.
I am back. So, so we are talking about the international aid. So we are just saying that when countries, usually developed countries want to assist developing countries, and even some developing countries like Nigeria, they once in a while also assist less developed countries. And then we were saying that when countries give help, it is not just because of philanthropy, but because they want to benefit. They also benefit from such. They also benefit from such. We gave an example of say if you get vaccinated, it means that you are not going to transmit the disease to others, and you are not. If you travel to those countries, you are not going to infect their citizens. And then we also said that one other example is that, of course, okay, the other thing is that if you are vaccinated, it means that the resistance strain, you are not going to develop resistance strains. You know, resistance strains usually develop when the disease spread without being challenged. Okay, and probably that was what they did. Usually, when during an epidemic, they usually do a modeling. They just model the situation, and then when COVID-19 came, and then they felt that with the modeling they did, considering the insanitary conditions, the social interactions that are common in our environment, the poor health system, they just concluded that 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 there will be a lot of casualties, mortalities in Africa. Thank God it didn't turn out that way, because perhaps we are stronger. We are very strong. In fact, Africans are very strong. Is the reason why, in spite of the horrors of slavery, we still persevered. And then the American Indians, the indigenous communities of America, they were nearly wiped out. They were nearly wiped out. They are nearly wiped out, but we survived. So that was why those modeling they did proved wrong. Okay, so the other reason, another example of this global public health good is family planning. It's family planning. Family planning. Remember Thomas Matthias, close to 300 years ago, he predicted that there will not be enough food to go around. There won't be enough food to go around. And people still believe. People still believe that the earth has a carrying capacity. The carrying capacity has a carrying capacity that if the world human population gets to a certain level, the earth will no longer have the capacity to feed everybody. So that is the reason why. That is the reason why people are interested in helping people control the number of children they will have. In helping people countries control the number of children they will have, mostly because they want to protect, they want to ensure that the earth continues to survive, support the human population. But the other thing too is migration. Migration. They don't want you. They don't want the number to be such that people will want to come to their countries. And when they come to their countries, some people have been known to cause trouble, or to change the demography of of the country. For example, in the Europeans, or even the Japanese, the women, the family size has shrunk. People get married and they are not interested in having children. And meanwhile, when people come from developing countries, they give birth. They give the average like the average woman in Nigeria gives birth. Gives birth to, even up to now, gives birth to more than 5 children, close to 6 children. So they can easily overwhelm the indigenous population. And that is the reason why some of these far-right persons are seriously fighting against migration. Okay? So these are some of the reasons, and these are some of the public health goods, global public health goods, that when you use, you benefit. It not only benefits you, but also benefits others. Immunization, family planning. Okay, so I think we can pause here to get comments from you, or comments or questions. And let me apologize for the power outage. I don't know if there are questions or comments. Hello, also Deepa. I had to make you the co-host because I anticipated that I will lose my. There will be a power outage earlier. So I don't know if you know how to transfer the whole ship or make me a co-host.
Okay, let me check, sir.
So that I can just click. If you click my name, there will be 3 dots. Click there, and there will be options.
I've seen it, sir.
Thank you. Yes.
I don't know
hello,
if I can. Can I go with
hello,
my question? Yes, sir.
Yes, you can go on. Yeah.
Okay.
Yes.
Thank you so much, sir.
Thank you very much. Yes.
Can I go ahead, please?
Yes. Go, Juliet. Go on.
Okay. Thank you so much, sir. Sincerely,
Yes.
like your name had said, you are Prof. Best, and you are really the best. You are making this lecture so interesting. I have been in the public health space for a while through NGO work, and when you mentioned being out of job, it was like you are seeing through me at the moment. But the whole story around social media and what has been happening, I am still being concerned regarding the unspoken interest of these funders. I know at the tail end you were able to mention global health benefits, how it does that, but I still feel that some of these individuals have some motives they are not telling us. For instance, I think it's Bill Gates who is having this mosquito factory, producing millions of them on daily basis. For he said he will use it to control like the dengue fever and the rest. It still gives me concerns. These mosquitoes are being fed with human blood. Where are they being gotten on daily basis for that number? Still being in the public health system. And I know that if it works out good, it will also help us in containing these diseases. But I'm still being concerned and skeptical around the whole thing. Thank you, Anova.
Yeah, Juliet, thank you very much. Anyway, I'm sure that you must have heard of that, the term neglected tropical diseases. Yes, very little research. Very little. If you have a sleeping sickness, the one they call transmitted by fly, you'll be treated with a drug, antimony. That drug, that is, in fact, that antimony as a metal is said to be carcinogenic. So most of those drugs used in those tropical diseases, if you find a drug, that drug is usually very toxic because drug companies are not interested in carrying out the research. Because if they manage to find drug, they can't pay. They can't pay the fees. They can't pay the price that will make it profitable. So instead of doing that, instead of wasting money, they would rather go and carry out research on Alzheimer's, senile dementia, that is currently affecting those in the developed countries, and they have money. So we have to thank anybody that is doing what any research, funding research, because to tell you the truth, they believe that the best way to control the mosquitoes is to breed sterile males. To breed sterile males. That, of course, they will not be able to fertilize the eggs of the females. So probably that would be to them, that is the best. Because they have tried DDT. In fact, when that chemical was developed, the WHO launched an eradication program, and they were spreading DDT all over. What did they get? The mosquitoes became resistant. In fact, most of the drugs, multi-malaria drugs, are now developing. You are now developing resistance. When I was growing up, chloroquine used to be the drug of choice for the treatment of malaria. But right now, over close to 50% of the malaria parasites we have are resistant to chloroquine. Okay, so that's what I feel. And the other thing too, for what purpose? For what? For what? For what? I'm sure that nobody begrudges, nobody is saying that kind of thing against Elon Musk. He's using his money to shoot rockets. He's using his money to shoot rockets. He's not interested. In fact, if he's interested, you see, he's known to probably be against some of us. Okay. So that is personally, I just believe that those people that have committed their funds, their money, should be encouraged and not vilified. Okay, and of course, okay. Sorry, I think I'm even taking it that long. When the Islamic scholars in some Islamic leaders started discouraging people against polio vaccination, and outbreaks were recorded in northern Nigeria because they mentioned, that they are using it to sterilize people. What did the Kingdom of Saudi Arabia do? They promptly required all Nigerian pilgrims to get immunized against polio, whether you are an adult or a child. So the kingdom, Saudi Arabia, stopped them. So that is the thing. So that is the thing. Thank you. Peace. Hello, Peace.
Hello, good evening, sir. Thank you so much for the lecture.
Hello, Peace.
Can you hear me, sir? Can you hear me, sir?
Sorry, I am not.
No, it's fine.
I don't know. Peace.
Can you hear me?
Okay. Peace is not responding. I'm sure that perhaps trying to.
Can you hear me now, sir? Good evening.
It's not from you, it is network. We can hear you.
Please, we can hear you, but I don't think Prof can hear you.
Okay, Prof, can you hear me? Should I go on?
Prof has
I don't think it's on again.
Okay. Oh, okay. Maybe it's gone off again.
He's thanking Village. We want to appreciate the Village for her question.
It's about this whole conspiracy theory thing and the likes of Bill Gates, sponsoring healthcare system in Africa. Personally, yeah, I agree with Prof that, these are lots of conspiracy theories and all that. And then what these people have done oftentimes is more than what most of our leaders have, right? But I think, just like Juliet said, I think there are oftentimes underlying motives, because I think one person should not be that powerful against a full continent. One person should not champion the healthcare system, as a single person, as a single unit, as a single entity, of a full continent. A full continent. The guy is sponsoring. So if he has that amount of power, so what stops him from pushing an agenda if he likes? I mean, we're all humans, and humans oftentimes have agendas, right? So what stops Bill Gates from pushing an agenda? Look at USA. The thing about USA, yes, USA folding up cost some people their jobs, but the findings by Trump's administration were quite alarming. That USA that is set to be helping had done a lot of undoubtable projects, was also found to be sponsoring terrorists, and there were documents to that effect. And this was not even conspiracy theory. This was US government releasing documents against USA. So I think all these things is as a result of failure. African government system, African failing, themselves. Because if Africa was not a third world nation, they won't be subjected into receiving these aids, and therefore having somebody call the shots on important factors, important things in our lives, as a people, like control of population, all those sponsoring of terrorists because you are receiving aids, ulterior motive. Good luck, Jonathan talked about, Barack Obama wanting him to sign in the gay law, and him not winning the presidency. So all these things, I think there's some level of truth to the conspiracy theories, and I think it's largely because our government has failed. Government has failed. So I just wanted to share this to stir up conversation so that we talk while wait for Prof. So instead of just keeping quiet, that.
Yeah, you're actually correct, Dr. Smile, because it's no longer news for someone to say that Bill Gates has kind of an interior motive. Though when I
listening to Prof's lecture about that. Yes, he did well. Of course, he has done to for an average. I don't know whether you just say clips or videos that have been stirring some kind of information that are very like uncomforting about um this guy. What is his name again? Um this guy, I forgot. I just called his name just now.
I
Okay,
think
Prof is already.
Prof is back online. Thank you.
Thank you. Sorry, I don't know. Is that outage? Okay, so quickly, please, you were about to ask your question.
Yes, good evening, Prof. Thank you so
Yeah,
much for the lecture. All right, so I wanted to ask. So when we're talking about the global good, like public health good, right? So you
yes,
talked
global
about
public health
the
good.
yeah, so you talked about the family planning as part of it, and about the theory that the earth and all of that may not be able to feed the number of like um, population and all. So I wanted to ask, was that where the whole family planning originated from, or there's another something that actually sprung up the whole idea for family planning?
Yeah. The thing there is this. Feminists, they want the women to go beyond being a baby machine, baby making machine. The other things. If you are actively engaged in in childbearing, you may not. It will affect your career. Although your career, yes, your career outside the home. Outside the home, my my mom had 11 pregnancies, and so which means and if you nurse a child for say at least a year, it means that you are you're almost out of the workforce for those 10 years for those years of active childbearing. So some feminists will want us, and then the economic situation too. You want to have you want to have children that that you can take care of. It is not about quantity; it's about quality. It's about quality. Having children that can compete. Having children that can compete. And for you to make the children to compete, for you to have children that can compete, it means that you should be able to train them. You should be able to train them, give them very good education. And in in a lot of countries, so developed countries, citizens are their main resource. For example, Japan has very little natural resources, so it depends on the productivity of its citizens to make progress, and that productivity is related to how well people are trained. And it is not about number. It used to be said, going by the GDP, it used to be said that what an African will spend the year working to earn, someone, the average person in the developed countries, will just have to work up to 12 noon, 1st January, to get that. So what are you stressing yourself? What are you stressing yourself for? And that's why they can afford to go on holidays. And we cannot. We cannot. It's difficult for you to just go leave your work and go on holidays. So some of these things will have to be factored in. Some of these things will have to be factored in. And then, yes, has to be factored in family planning. And you know that even countries countries like China, they just felt that they can't make progress with the number of Chinese. They had to. In fact, they instituted that one child policy. That one child policy, which means that they weren't even getting up to the level. They were reducing each generation. So if a couple, the couple will be two, and if they are forced to have one child, it means that you have reduced the population by 50%. And where is China now? China is not developed. Unfortunately now, they are now beginning to have aging population. So they don't have enough people to regenerate. But suddenly AI has come. AI has come. A lot of the things human beings are supposed to be doing, AI will do them. So it is left for you. It is left for you to have a child. In fact, personally, I have a lot of children, and I'm just wondering, when I just look at it, I have survived. But when I just look at it, I just wonder, can my children also survive in this country? Okay, I think I will leave it at that. Nwankwo Emeka Nwankwo. Hello, Nwankwo.
Okay, good evening, Prof.
Yeah, good
Can
evening.
everyone hear me? Thank you very much for the wonderful lecture. It's been very interesting so far. I have a couple of questions, but I'll start with the United Nations Population Funds. When I look at the acronym, it is not like, I know you explained in UNICEF that the emergency was removed, but it still remained UNICEF. But I didn't get when you explained how the acronym is like this and United Nations Population Fund. I don't see any word that the letter A there represents, and the population.
It was formerly United Nations Fund for Population Activities.
Okay.
Yes.
Okay. Thank you very much. Then my second question is about this Bill Gates matter. I want to know the extent, the skepticism towards the global vaccine and aid Bill Gates himself gives. Is it rooted based on misinformation, or as a result of the legitimate historical public health failures of the past? So this skepticism.
Yeah, if you say historical failures, indeed, I'm sure that is actually the source, because they were. Times racism, racism is a serious thing. A serious thing. It didn't end with the end of slavery. The African Americans, they fought a lot. Discrimination, lynching, and a lot of things. A lot of things. And human experimentation. Even in the US, they went and black sharecroppers, and they went and those that had syphilis, they recruited them into a program and didn't treat them because they wanted to find out how the life history of syphilis infection if it is not treated, and a lot of other things, other things. But usually when things are when they want to do those things, it's more likely to be bilateral. It's less likely to be in a multilateral setup like the WHO, because you have people from all over. You have people from all over working together. So it's difficult for them to have ulterior motives. Even this provision of vaccine is done under that Gavi. In fact, there was a time our own Okonjo was part of it. Was part of it. So if they had wanted to do anything untoward, it would have been, they would have done it probably as a private initiative. As a private initiative. And yes, as a private initiative. So, Wanko, I don't know if you have another one, but we have had a lot of interruptions.
Thank you so much. I don't
yes,
think I
if you
have
just
any other
quickly go
question.
to the history of public health services in Nigeria, okay? And we are interested in although we talked about public health in traditional societies where the chief priests actually did everything to ensure the safety of people in communities. Okay, but when the British came, public health became very, very important. Public health became very, very important. And the British, they were actually able to succeed in colonizing Nigeria because they did that at the golden age of public health. When Rockefeller had funded the discovery of a lot of the germs, discovery of a lot of those tropical diseases like malaria and yellow fever and the rest. So they had that body of knowledge before coming to Nigeria. In fact, we have said that malaria killed more Europeans than our forefathers, irrespective of their strong juju. Strong juju. Strong juju. Irrespective of strong juju, people, those stories that they used to tell in our communities, rural communities, about people appearing and disappearing, about people that are immune to gunshots. But nothing. Those Europeans, those British, very few of them came and then conquered even up to the Benin Empire and the rest. So malaria killed a lot of them. So, but when the British came, they had to battle. In fact, okay, we are talking about those discoveries. And we are probably familiar with Lord Lugard. Lord Lugard was the first Governor General of Nigeria. It was he that amalgamated the Northern Protectorate with the Southern Protectorate to create Nigeria. Writing in his memoir, he said, it is primarily due to medical research and to the zeal of medical officers that the wonderful decrease in mortality amongst the Europeans in West Africa is to be ascribed. So it was because of the findings of research findings, which they were able to implement. So they introduced public health methods that can be divided into two. One of them dealt with endemic diseases like malaria. Endemic diseases are endemic in our communities, in the African communities, in the indigenous communities. But the colonizers didn't have any immunity like malaria. So they control these endemic diseases using methods we are going to discuss later. But these methods were geared towards their own protection. Okay? The other type of public health actions they took were targeted as those epidemic diseases. And these are diseases that they brought into our country, into Nigeria, into Ghana, or
I think the network is at it again. I can't hear you anymore, Prof.
Yeah, it is network.
Sure, I came home. And okay, it's all right. I think sorry, we'll persevere. Okay, so there are basically the ones epidemic diseases are the ones that they brought home, they brought to our country, or their actions facilitated the outbreak of these epidemic diseases. So let's go to the endemic diseases, the diseases that are common in our environment. They use the three main methods: the personal protective methods. They created GROs, and they use environmental sanitation. For personal protective methods, they took they took measures against malaria, against mosquitoes, against mosquitoes. In fact, sorry, apologies again. In fact, I've run out of. Okay, it's all right. So for the epidemic diseases, endemic diseases, they took measures against mosquitoes, and the measures include taking quinine, um, sleeping in story buildings, because they felt that the higher they slept, the less the mosquito bites, and then they installed mosquito nets in their doors and windows. And not only that, they employed young boys to stay awake at night to kill those mosquitoes while they slept. They also took strong alcoholic beverages as prophylaxis against stomach ailments. Okay, stomach ailments. And then, but the most prominent act they did was the creation of GRAs, government reserve areas, or government residential areas. These government residential areas were almost like a place of refuge against mosquitoes, and they did everything. They did everything. They did everything to ensure that they separated themselves, these GRAs, from the African towns, because they believe that mosquito parasites are more in the African towns. And then they were also very, 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 very scared of children, because they believe that children had very high levels of these mosquito parasites. And that is where the boy spotters, the concept of boy spotter, came into being. Boy spotter means that what they did, it was the policy that they had servants, but those servants were not allowed. Those servants were accommodated, but they were not allowed to come with their children. And hence the word boys. Boys. So they preferred, they didn't want the children, because children were seen to be source of mosquito parasites. So they didn't want them near them. They also ensured environmental sanitation. Environmental sanitation. In fact, in all the GRAs, they had sewage treatment plants. They had sewage treatment plants. Okay. for measures they took against the epidemic diseases. These epidemic diseases were very, very common. Influenza, yellow fever, smallpox, tuberculosis. They were all very, very common. Not only because they were very new, they were newly introduced into our population, but also because the British introduced railways, and with railways, people could move from distant areas, people could travel easily, resulting in the spread of these epidemic diseases. If you recall, Nnamdi Azikiwe, the first Governor General of Nigeria, was an Igbo man from Onitsha, but he was born in 1904 at Zongero in the north, which means that his parents would have traveled to Zongero before 1904 when he was born. So all these ease of transport encouraged the outbreak of these epidemic diseases. And what did they do? They appointed medical officers of health. They encouraged environmental sanitation. They created mobile field units, and then they used health education. For medical officers of health, they appointed Dr. Isaac Oladipo Oluwole as the first Nigerian medical officer of health, to ensure that public health standards are kept in those African towns, to ensure that African public health standards are kept in these African towns, and also to operationalize the Public Health Act, which was first enacted in Nigeria as the Public Health Ordinance in 1917. So Isaac Oladipo Oluwole was of course one person. So he recruited and trained the sanitary inspectors at the Yaba School of Hygiene. He trained them, Yaba School of Hygiene, which he established in 1920. Okay, so these sanitary inspectors then went door to door, inspecting people's homes and other premises, and then compelling people to clean up their environment. In fact, in the southeast Nigeria, these sanitary inspectors are still called Wole Wole, which literally meaning Oluwole boys. So we also said that they created mobile feed units. Mobile feed units, they were mobile. They moved from community to community with their supplies, and especially when epidemics are reported, they just go there, vaccinate people, show films, and treat, and they moved from community to community. So almost like a mobile police, moving from place to place, from community to community, carrying out that. Okay, they also use the health education, and they also use health education, and they use health education in various forms, in outpatient clinics, in schools as hygiene education, door to door by health visitors, through voluntary organizations, and through audiovisuals. For outpatient clinics, the dispensaries and the hospitals of those periods, they provided health talk, and the good thing is that this health talk is still being carried out in public health facilities in Nigeria. Okay, they also did health education in schools, and these health education classes were not only given by the teachers, but also health workers. Health workers came to those schools to give health talk to the children. This was actually prioritized because they believe that if you train the children, they will go back to their communities to train, to teach their parents, and then also teach their peers. So health education in that period was almost seen like training the trainers. You train the pupils, they will go home, tell their parents what they have learned. And they also told their peers that didn't go to school. So health education in schools was prioritized during that period. And then they also had health visitors who went door to door to inform people, tell them about health conditions and how to do and how to respond in the case, how to prevent and how to respond in the case of during epidemics. And then they also work through voluntary organizations like the Young Men Christian and Young Women Christian associations. And through those associations, through those voluntary organizations, they were able to disseminate health information. But perhaps a showstopper, what was very, very effective was their use of audiovisuals. They created educational films and then had mobile theater, mobile film facilities. They just move from community to community, showing films, using the opportunity not only to show films, but also to encourage, to vaccinate people and do other treatments. So this was used, in fact, as early as 1929. One Mr. William Sellers was actually in charge of health education and was producing health education films in Nigeria, and then went door to door. And you can actually see, you can actually predict, you can actually tell the kind of impact it could have made. Mere information that a film will be shown would have drawn people from various communities to converge in that area and watch the film. Okay, so these are the things they did to control these epidemic diseases. Not only for the endemic diseases like malaria, they did that to protect themselves. For the epidemic diseases, they did that to control the outbreaks, which was actually also hurting their economic interest because they came to Nigeria to make money. And if during epidemic situations when people have lockdowns, they can't make money. They can't make money. So it's one of those. This is one of the reasons why they put a lot of effort to control these epidemic diseases. Okay, so sorry for the disruptions, but I don't know if there are questions or comments. I can fill up if if there are questions or comments, you can. Osabovo, sorry, Osaibovo. I hope I don't. Your hand has been off for some time, but I guess. So I don't know if you want to ask a question.
Sorry, Prof, that's a mistake.
Okay, no problem. So we can go to Solomon Eseda. Hello, Solomon.
Hello, sir. Good evening, sir.
Yeah, good evening.
Okay, sir. Thank you so much for this wonderful lecture and the way you simplified everything for us. So I have a question. Does genetically modified seeds have negative effects on human lives?
That is what you're going to find out. And because there have been for and against. And then some people are also talking about that if you introduce it into the environment, it will probably affect. And some of them, yeah, it will affect. But I was just wondering, if you are anyway, your name sounds like, okay, gives you out like at least a Christian, you have read the Bible. When Jesus fed those thousands with 5 loaves of bread, if you meet that kind of miracle, will you eat the food? Hello, Solomon.
Yes.
Okay, Solomon, I don't know if you had me. So if you just go to a place, a crusade now, and somebody, somebody will bring out 5 fish and some loaves, and then multiply them. But that's how it is. When it comes to in my place, they used to say that the only thing that a hungry man understands is food. Is food. And then we were talking about Thomas Matthias. He believes that based on the agricultural productivity, that we may not be able to feed ourselves. But with Green Revolution and now GM, because if you see a GM crop, they are far better. Bigger. They are far bigger, so they are able to ensure food security. But it is obvious that they can destroy the what is it called? They can destroy the plants. They can destroy the plants. Just as I just yes, So I think I can leave it like that. Okay. So thank you very much. This class, this lecture, we have to we also give it to the other people. So where I was able to introduce this other part of the course, the ethics, professional ethics, and the public health is professional. It's professional, especially the MPH. The MPH used to be a professional degree that a lot of people have asked me, will they be able to use their MPH to do a PhD? Yes, I know where that question came from. It was because MPH used to be a professional degree. Professional means that it is practice. It is aimed at training people to become public health practitioners. And that is actually what schools of public health are established to achieve. Remember, we talked about the Rockefeller Foundation that actually aided the establishment of probably the first schools of public health and the foremost, Harvard, John Hopkins, Liverpool School of Hygiene and Tropical Medicine. Okay, so which means that professional ethics is very important. A professional ethics actually teaches what is wrong and what is good and what is wrong in professional practice. Okay, so it's important. This aspect is important. And to start with that comes with the client. Who is your client? Professions or professionals deal with clients. And public health, the clients is the public. And the responsibility is to ensure the health of the public. Okay? So within a public, you have communities. And a community is a group of people with common interests residing within a defined geographical location, which means that, say, in Nigeria, in Nigeria, the Nigerian state or the country is divided into the country, the states, the local government, the wards, and then the community. Okay, so if you are given responsibility, if you work in the local government, it means that you have several communities that you are in charge of, rural communities, urban centers. In River State, we have riverine communities, upland communities, and even in towns, you have the old township where you have the older houses. In Port Harcourt and in most parts of Nigeria, those old houses, they were built without water closets, water flush toilet. They were built and served with buckets, the bucket system, where nice soil men. And those houses were what they call the face me, I face you, multi-household houses. So you have them. And then we have the newer parts of town where you can even have the estates, and estates are usually planned with other facilities. Okay, so we talked about that, about clients, that your clients is the communities in which you serve. If you are a community health practitioner, community health practitioners are posted to serve a single community. But if you are a public health practitioner, you are likely to be working in a local government. And if you work in a local government, a state, and so forth, then there are two ways in public health practice. There are actually now two types of public health. We have the vertical public health that is interested in specific diseases or specific conditions. And this vertical public health, they include HIV/AIDS control, malaria control, tuberculosis, vaccine preventable diseases. They are interested in one part, in one disease or one disease condition. I must tell you that the donor countries, the donors, are interested in this vertical public health because they are able to show working. They are interested in things that are easily countable. If you are funding, if you say you are providing funds for HIV control, you'll be interested in the total number of patients enrolled and total number of patients that you are able to achieve viral suppression. Okay, and of course, if it is tuberculosis, those enrolled and those cured. So you are able to clearly show what your funds have done. Then, but we have this horizontal public health. Those horizontal public health, they take care of specific communities, and what their interest is to ensure the health of everyone in that community, Remember, we told you about the medical officer of health. Medical officer of health is posted to take care of everybody in the council, in the municipality. Okay, everybody in the municipality. Okay, and this public health, if you practice horizontal public health and you are given the responsibility of taking care of everybody in the community, the measure how well you work is not measured by the total number of things you do, but by the outcome. Okay, and that outcome is mortality rate, especially under 5, and maternal mortality. Or in some cases, they do life expectancy or other things like the outbreak of diseases. Okay, those are the things that you are measured. Those are the performance evaluation. Those are the performance evaluation, and those are the things that will determine whether the medical officer of health, who is given responsibility over a whole local government, has done well or not. Maternal mortality. because they believe that no woman should die in labor. So if you allow, if there is any case of maternal mortality, that is an indictment. It shows that you have not done, you have not done well. You have not done well to ensure, to stop that woman from dying. And because of that, every incident of maternal mortality is investigated so that lessons can be learned. The same thing with under 5 mortality. Cases are investigated so that lessons will be learned. Okay, so that is what horizontal public health is, and that is what community environmental health. That is what medical officers of health. That is what they practice. That's how. So medical officers of health are engaged, are posted to serve the local government. But we know that in states such as Lagos and I think even in Delta, public health officers are beginning to be employed. Probably because they have, say, a degree in public health, which means that it will come to a point where they will be probably posted to take care of a ward. And if they are posted to take care of the ward, they will have to practice horizontal public health. The problem with horizontal public health is that donors are not interested. A lot of them are not interested in horizontal public health, where the efficacy or the performance is measured with those indicators. Because we know probably later in this program you'll be taught about in population and reproductive maternal mortality. You will know there are a lot of factors that are responsible for maternal death, not just medical. In fact, you will come to know about the delay in recognizing the problem, delay in taking the decision, delay in getting to the hospital, and delay in even receiving treatment in the hospital. All these are not medical and are factors beyond medical control, but they are nevertheless very important in maternal mortality. And that's why the donors are not so much interested. Yes, no more interested, because there are a lot of force majeure, things that are beyond their control. So that's why they are interested. Even the donor agents, even the international multilateral organizations like UNICEF, they are not. They actually are moving away from this maternal mortality and infant mortality thing, and they are going into this child survival strategy. You see, is also a way of generating indicators that will leave out these non-medical causes of mortality. Okay, so we have to clearly state this responsibility, the responsibility of a public health practitioner, whether you are practicing horizontal public health or you are practicing vertical public health. Okay, so the other thing we have to say is that public health practitioners, public health practice, of course, is a profession, and the client is the general public. The client is the community, the public you have been posted to serve. Although governments are usually have the interest of the community at heart, but we have found instances. There are instances where it wasn't really so. For example, during the COVID-19, states like Akwa Ibom, Cross River, Okogi State, they all took actions to suppress or reduce the number of COVID-19 cases reported within their states. And civil servants, especially the state epidemiologists, were put under immense pressure to reduce that. The good thing is that a lot of them refused. A lot of them refused and even paid the price. We are even sacked for that reason. But we have to say that usually they win. If they take the case to court, they also win. They usually win. And of course, that is where professional organizations, associations should come in. Although we don't have a strong society for public health practitioners of Nigeria, but that is where NGOs and all the others are supposed to offer the support. So that is it.
The key in the right place. So.
I don't know. Okay, so let me just quickly continue and just round up. Okay, so public health as a profession, you owe it as the duty to your clients, and then you owe them the duty to serve them, to advise them, to take instruction, and to act in their best interest. And then if you are employed, especially if you are employed with a certificate, expected that you have a certain level of skill, of a certain skill set. And if you fail to minimally, to meet the minimum acceptable standard, you can be held for malpractice. You can be held culpable and can be sued for malpractice. And there are 3 types of malpractices. You have the non-feasance, when you fail to act when you are supposed to act. You have the misfeasance, when you act inappropriately and willfully. And then you have the malfeasance, when you willfully acted inappropriately with the intention of injuring the client. We are going to give examples. The first one is a non-feasance, when you fail to act when you are supposed to act. When you fail to act when you are supposed to act. When you fail to act when you are supposed to act. For example, during the Black Suit crisis in Rivers State, it was widely known that the militants were responsible, but the government failed to act. So we can say that we can accuse them of non-feasance. Then misfeasance is when the action is willful and inappropriate, such as when during the COVID-19, where some states they engage in malpractices to artificially reduce the number of cases in their states. And then malfeasance, a willful intentional action that injures the client. An example I can cite is the case in America, where you have the pro-choice and the pro-life. Pro-life are against abortion, while pro-choice do everything to support abortion. Okay, so it has been reported that some pro-lifers actually set up fake abortion clinics. So when a woman needing abortion comes, they will deceive her that they have carried out the abortion so that she could carry the pregnancy to 12 weeks when it becomes illegal to have an abortion. So these are the 3 malpractices. Okay, I think I won fumbled and wumbled to the end. I don't know if there are questions so that we can leave before this network strikes again. Poor network strikes again. I don't know. Emanuela, Emanuela, I don't know if you want to ask a question. Hello, Emanuela. Okay, so we can go to Doye. Hello, Doye.
Yes, good evening, Prof.
Yes, good evening.
Okay.
The way your name, you wrote your name, it seems you want to put it to us.
Yeah, no, I am still under my level of tutelage. I'll still subject myself to questions.
Okay, no problem.
I want to be led.
No problem.
That's why
no
I'm
problem.
here. In the issue of institution of actions.
Yeah.
Is it by way of class action, or do you think there will be some level of weight attached if it is an act for institution brought in by one person? So my question precisely is, what is the mode of which matters can be instituted according to, with respect to public health observations? How can matters be instituted against anyone, against the government, in this light? That's my question, Paul.
Okay. Yeah. Against the government, public health agencies, they are mostly governmental institutions. So it may not be instituting against government. But perhaps you mentioned class action. It can be. We can go through that route. You can go through that route outside, or even NGOs bringing up the matter and holding the government into account. I think we are also going to look at that later.
Okay.
Because we have, yes, we have.
Okay.
Because usually the litigation is when it affects the public. When it affects the public, it's the government that will sue on behalf of the general public. But when it affects if an individual, and I say there is a gas flaring, if an individual can only sue when that individual is able to prove that the gas flaring is affecting him or her more than the average person.
Okay.
So that is how it goes. Yeah.
Okay.
Thank you very much.
Thank you so much.
Yes. Yeah. I don't know if Emanuela is willing, or we can go to Lydia. Hello, Lydia.
Good evening, sir. Okay.
Yeah. Yeah, go on.
Okay.
Yes.
Okay, sir, good evening. Thank you so much for your lecture. Okay, please, sir, I know you mentioned the vertical and the horizontal approach, but I'm aware of a diagonal approach in public health, because currently services like HIV, tuberculosis are being handed over to the government, are being integrated back into the the government's or the primary healthcare. And
they want to run.
And all. Yes, sir. So I don't know.
They want to run.
Yes, sir. I just know you didn't mention. I don't know if it's like part of it or not. Thank you.
No. The thing, just as I said, in the horizontal is more of what government should be doing, because the primary purpose of government is the security and welfare of the people. So the government should practice horizontal. Horizontal. And it should be. In fact, when WHO was publishing its yearly World Health Report, countries were ranked based on their mortality rates and their life expectancies. So the league table of countries is usually calculated using the mortality rate. So it should be the responsibility of government. So government should take care of everything. And a lot of those things are cross-cutting, inter-agencies. For example, you get people to, delay in taking decision, for example, in maternal mortality, has to do with women empowerment. Women, there are certain women, also anyway, in some several parts of Nigeria, before a woman can go to the hospital, the husband must give consent, perhaps because the husband has to foot the bill. Okay. I'm almost giving up. But so anyway, I think I just answered that. I just hope you got that. So the reason why the government should practice horizontal, and of course with the stop work order of USAID and Donald Trump, people are abandoning. And then not only US, the other countries, the other developed countries, especially those under NATO, Donald Trump has told them to increase their defense budget, that the US will no longer defend them. So a lot of them are moving away budgets that they were using for international aid and now using it to fund their defense. So a lot of things. So we have to own up. We have to own up and take responsibility. Okay, so that is that. Hello, Wankwo.
Okay, good evening, everyone. Thank you, Prof, for this wonderful lecture. I have two questions. The first one is the current global vaccination strategy more vertical or horizontal in nature?
Yeah, I think is vertical. Although it just as this is my network. I hope you can allow me just
I can
finish.
hear you.
Yes, just as the other ladies talked about. Yeah, just as the other lady talked about horizontal. Although they try to make it vertical. In fact, even up to bonded, not just to provide vaccination, but all the things that are needed including the safe disposal of the immunization waste. So they were at the time they were even providing incinerators. But if they provide incinerators, it's not just for vaccination. It's not just for vaccination. It's not just for vaccination waste, immunization waste, but other things. So although immunization is basically a vertical program, and that's why you have EPI and MPI, they are all vertical programs. They are both vertical programs, but the extra fundings they are able to generate are some of them are being used to improve other services in the health facility. Okay. Hello, Princess.
Thank you very much. Then my second question, sir.
Okay, go on.
The second question is, in low-income countries, which approach tends to which approach tends to be more effective, especially during epidemics, and why is it so?
No. In epidemics, they use their own model. When you declare an epidemic, you have declared an emergency. And emergencies, they stop all laws are stopped to deal with that emergency. All laws are stopped. It's good that we have a lawyer here. All laws are stopped. And the government becomes very powerful. They are expected to do everything to stop that emergency. Everything. Although later we'll come to know about the Saragossa Principle. Saragossa Principles are safeguards put in place to stop government or public health authorities from misusing the extra powers granted it in when emergencies are are declared. Okay, so that is my answer to that. I don't know if Emanuela will want to still ask a question. Emanuela, do you want to? Okay, thank you very much. Let me continue to apologize for the disruptions. In fact, I'm having some problems with my electricity supply. It has been fluctuating, and I'm using a Starlink. If there is any disruption, it takes some time to get back to normal. So thank you very much. Thank you for your understanding, and thank you for even agreeing to attend these lectures on a public holiday like this. Thank you very much, and have the best of the rest of the day. Thank you. Thank you.
Prof.
Thank you, Prof. Thank you so much.
Thank you, Prof.
Thank you, Prof.
Thank you,
Have a
Prof.
good evening.
Thank you,
Good
Prof.
evening, sir.
Prof.
Thank you,
Thank you.
Prof. God bless you.
Lecture. Good night. Have a good night first.
Good night.
Night.
Thank you, Prof.
Thank
Bye,
you, sir.
everyone.
Thank you very much.